Today's discussion is about heel fissures. Cracked heels, also known as heel fissures or sometimes known as skin fissures, are cracks that occur in the back of a heel, usually on both heels. For some people, this can be a chronic problem, which is more annoying than dangerous. However, for others such as diabetics or people with poor circulation or people with immunosuppressant diseases, this problem can have major consequences. At times, the cracks can be very painful. Skin fissures can occur in most parts of the body, but they are most common on the feet and hands. What causes a painful heel fissure? The following situations will cause fissures on the heels to dry out and eventually crack. Simple dry skin known as xerosis. Secondly, disruption in the barrier or protective function of the skin leading to increased water loss from the epidermis, which is the outer layer of the skin. Low humidity as seen during the winter can dry out and crack skin. Genetics, some people are just prone to dry skin. Diuretics. People on water pills lose water from the body which will dry out the skin. Decreased sweat gland activity can also cause dry skin. Additionally, a condition known as dyskeratosis, which is abnormal formation of the keratin layer of the skin, which is dry, hard skin. Medical conditions including venous stasis, eczema, diabetes, hypothyroidism, Down syndrome, kidney disease, lymphoma, and malnutrition may also be precursors to heel fissures. Another causative agent is people who wear backless shoes. Over the years I've seen this condition to be more prevalent in heavier people and those that wear backless shoes. Regular shoes that have a back to them keep the heel cupped. In other words, the skin and fat of the heel area is pushed together. When you wear a backless shoe, all the body fat and skin is displaced laterally and it tends to become calloused. And since calloused skin is not healthy skin, it will begin to crack and the heel fissures will form. Lastly, obesity. Obviously, the heavier you are, the more the heel fat and skin is displaced laterally, even if you wear shoes with a back to them. This puts pressure on the skin to break open and the heels to crack. The question then becomes, what is the big deal about heel fissures? Well, many people find it to be cosmetically unacceptable, particularly women who wear very dressy shoes. Some people find heel fissures to be painful. Initially, as the skin begins to split, there is not too much pain. But as the fissure deepens and also lengthens, it eventually affects healthy skin and will begin to hurt. It's similar to any other cut you may have on your body, with the exception that you are walking on it, which can make it more painful. The plot further thickens because these heel fissures are very prone to becoming infected. Once they become infected, they become even more tender, they start draining, and the area becomes red, known as cellulitis. It does not take a deep leap of faith to see how easily this can occur. The foot is usually subject to dirtier surrounding environments than the rest of the body, and bacteria can easily invade these fissures. In an otherwise healthy individual, this problem can be easily remedied. But as stated earlier, in a diabetic or someone with poor circulation to the feet or someone suffering from any disease state which increases their susceptibility to infection, this minor problem becomes a major problem. So what are some of the treatments for heel fissures? It's important to point out that many people who have chronic dry heels with or without fissuring do not know that they may also have athlete's foot in that dryness. The dry scaliness of athlete's foot will promote skin fissures. Ever wonder why you are putting on a ton of dry skin? Lotion on your feet and the heels never clear up? That is the reason. You're not attacking the athlete's foot. For that reason, I generally recommend an emollient and an antifungal cream mixed together and applied twice a day, usually for 3 or 4 weeks. For more resistant cases, I might even use an oral antifungal agent. The important thing to remember is that you can usually control athlete's foot, but it can be very hard to cure. Another scenario that I see is people who wear work boots all day with their feet perspiring. Generally, these people will throw the boots into the closet at night only to wear them the following day. If athlete's foot is part of the problem, then the boots need to be allowed to air out at night, either by being placed by an open window or on the back of the porch, in order for air to get inside the boots. Spraying the inside of the boot with an antifungal agent is also a good idea. As mentioned earlier, if you are going to insist on wearing open-back shoes, you can pretty much rest assured that you will never improve on heel fissures. Cold weather further worsens the problem because the colder the weather, the less humidity in the air, and the more the skin dries out. In many instances, avoiding open-back shoes and only wearing closed shoes does not remedy the problem because the fat under the heel still expands too much laterally in the closed shoe. The best way to keep the fat under the heel and allow the skin to mend is through the use of a plastic heel cup. People with very thick cracked heels such as the heels in the picture on the screen may need to have the fissures debrided. A podiatrist should be called upon. This will reduce the depth of the fissures and make them less inclined to bleed or possibly get infected. There are also topical agents out there known as keratolytic agents. Again, if the callus is so severe that even debriding the growth cannot rid the foot of the callus, I usually will recommend a keratolytic agent or a cracked heel cream, which are readily available in drugstores or on the internet. The patient is instructed to apply at bedtime. After applying, I then have the patient cover the heel with plastic bags and loose socks in an effort to further moisturize the area to allow for better penetration of the medication. The keratolytic agent usually helps dissolve the hard skin. My favorite type of cream is one that contains urea as it will dissolve the very hard dry skin. There are over-the-counter products containing urea, but prescription urea is of a stronger concentration and of course works better. Some people have very sensitive skin and unfortunately most creams and emollients are made from petroleum byproducts and have many synthetic ingredients added to them to change the smell or consistency of the cream. For those of you who have sensitive skin, you may try shea butter. This compound has been around for centuries and can be very effective. By reducing the size of the callus tissue, you are also reducing the depth of the fissure, and that will make them feel better and easier to close. Some doctors even go as far as to recommend crazy glue to glue the fissures shut in an effort to reduce pain. I am not a big fan of that because if the fissure happens to be infected, even mildly, you will essentially be gluing the infection into the skin and it will worsen dramatically. If a heel fissure becomes infected, that has to be addressed as well. For mild infections, topical ointments like bacitracin ointment applied twice a day with a dressing is helpful. My recommendation is to take a Q-tip and work the medication into the fissure itself because since bacitracin is an ointment, it will also help and soften the area. For more severe infections or people at risk, oral antibiotics may be necessary. Keep in mind that soaking your feet in Epsom salts or boric acid will only make matters worse since salts tend to dry out skin. The other point to come away with here is that in most cases, these are chronic conditions. Even if you clear up the fissures, there is a good chance they will return. Proper maintenance of your feet is necessary.